Great question. We're all looking for the best CME opportunities, the best things that are going to be the quote game changer in our practices, in our coaching, in our athletics. And for me, I'm a podiatrist, so this is a book that just came out about a year ago. It's Practical Biomechanics for the Podiatrist by Richard Blake, and he's got a companion book. And the thing I like about it, even the size of it, it's like a gold key book, like from when you were a kid. It's very approachable. Some texts are very technical, and although there's some very good points in the technical books, this one I think gives access from anyone from the student, the layperson, and then the seasoned practitioner, because there are some very good refinements to alter your thought process. The other thing that I would suggest for everyone is to interact with colleagues. I think that has been even more influential. And I have a forum that I do myself. It's called FitFoot U, where I interview various guests, coaches, doctors, athletes. And what I found is that sometimes I'll get a guest, and this is an example of one I had a few months ago, Dr. Ted Forkum, who's on this panel. He got me onto the idea of electromagnetic therapy for sports injuries, and I've been using it in my practice, and I find that has been the single most big change that I have had in my practice since I picked up diagnostic ultrasound over 15 years ago now. So that's been something I think that if you have some things you want to change in your practice, going out and finding people that are doing some different things than you are is essential. And the last thing is to look at some of the virtual summits that are out there, virtual programs. I'm doing one called the Biomechanics Summit, and that engagement again with the speakers has pushed me to improve my game.